Good morning, everyone. Welcome
Morning.
to our premiere episode number 1 of Live with Dr. Vincent. We're
Mm-hmm.
joining us. Um, Today, we just wanted to take some time and give you all a chance to ask some of your questions that you have had, things that are weighing on your mind around the wonderful world we're living in right now, the world of COVID, and especially
Sure.
when it comes to your kids. And so, Dr. Vincent's here with us today to answer your questions.
Morning.
If you'd like to, just in the comments below, start sending those in. Let us know what you'd like answers to. And we promise you, Dr. Vincent, he's got the answers. So without further ado,
I hope so.
we're going to turn it over to you, Dr. Vincent, and just let you run with it and start sharing some of the questions that maybe you've been getting on a frequent basis around children and COVID.
Sure. So just a little context. So I live here in League City, and I just went through. I have a senior at Clear Springs High School, and of course, we got the note from the school nurse that he was exposed to somebody at school, and it was kind of soft. Admittedly, I think he was like sitting in a desk for where some kid had COVID and tested positive. He was sitting in the desk a couple periods later, so we did have to endure the home quarantine issue. So I can certainly talk about that. I get asked a lot about what are the specifics of getting the these kiddos back to school, and is there kind of a way to, I mean, not really cheat it, but to shorten it as much as possible. And again, here's a little. We all had COVID this summer. Me and my whole family, we had it this summer, and we all did. We did fine with it. We did fine with it. So in the back of my mind, it's like, my son obviously doesn't have COVID again. We could talk about that as well. So how could I get him back to school the very quickest? And this is a good question. Do they really need to be quarantined for the full 14 days? Well, let's just jump right in there. So the CDC, here's the thing about COVID. If you're exposed, it might take 3 to 5 days for you to show symptoms. So we're just going to talk about the time. Where did they get this timeline? Let's start there. So it takes about 3 to 5 days to say if somebody like literally sneezed on you with COVID, between 3 and 5 days later, you would have COVID and you would be sick. And then on top of that, we do know once you have COVID, this comes from a study early on from South America. You basically are contagious for 10 days. So 3 to 5 days incubation, and then 10 days and you're clear. Now, what's even trickier about COVID, a lot of these patients, especially the younger kids, elementary for sure, a lot of high school kids have minimal symptoms. You may have no symptoms. So you may literally be contagious, you may contract COVID and then be contagious for 10 days. So that's where the 14-day thing comes in. So if you're lucky enough to be exposed, contract COVID, and be asymptomatic, then you actually do need that 14-day timeline. Okay, so there's always an option if you get the note from school to pull your kid out for that full 14 days. That would kind of be the safest. If you have, if you have maybe an elderly parent living at home kind of situation, that's kind of the safest. Now, if you wanted to shorten that, we do have technology. We love, we can talk about the various testing, but we love the PCR test because it's very sensitive. So say you were exposed to COVID, day 0, I'll try to get in line. Then you have a 3 to 5 day incubation period where you have an infection. If you test right around there, if you test on day 6, for example, with a very sensitive test, and I'm going to throw out PCR, there's pros and cons to it, but if you test with the PCR test at day 6 and you're negative, then you probably didn't get the disease at all. And so that would be kind of where the 7-day shortened time period is. So your kid gets a note, quarantine at home for 6 days, get a PCR test. Then on that 7th day, he can safely go back to school. And I know at Clear Creek ISD, they are recommending another 7 days, complete masking, no extracurricular activities, and that'll catch the end of that window. It's kind of a long answer, but we did just dive into it.
No, that's a great answer. Someone else asked, A similar
Mhm.
question. So, do the same guidelines apply? It was they were concerned about the details as far as guidelines for their child to return to baseball once they've been
Yeah.
separated from school because of potential exposure.
Right. So what's tricky about some of these guidelines is that you're going to have whoever's in charge of these decisions, whether it's club team or I know I have a little 9-year-old in League City soccer, so each leader of each group is going to have to, weigh the pros and cons, filter through all this data. I will say specifically, I know League City Parks and Rec, they're recommending the full 14 days off. They're just taking the safe road, and they want, if you're exposed or even positive with COVID, they don't want to risk, closing the season. So they're recommending the full 14 days, and that's going to be team dependent. If it's UIL, for example, if it's a Clear Springs or CCIC sponsored event, then they will abide by those rules. It gets very confusing. So I will say most sports, I think they're doing the full 14 days.
Gotcha.
That's a good question.
There's obviously now in the news a lot of information and things floating around and things moving concerning the vaccine. And Toby's asking, what, if any, side effects should be expected from taking the vaccine?
All right. That is such a good question. So I did get the vaccine as soon as I could. I was one of those A1 people working in the ER. So I tried to be first in line, but I got it like on the 3rd day that we could get it. And I had COVID. So I'll talk about my personal experience and then I'll try to filter through the news. So my personal experience, I felt a little bit like I did when I had COVID. So my symptoms were largely fatigue. I was very tired for like 2 to 3 weeks. So for the a couple days after my vaccine, I was sore. I was pretty sore. It was a doozy. It was kind of like a really, really strong flu shot, perhaps. So I was sore and I was a little bit tired for a couple days. Or in other words, I kind of felt like I did when I had COVID. And then as far as expected side effects, I think pretty much everybody, because this is it's the novel coronavirus, none of our immune systems really know how to deal with it. And so whenever you get, the vaccine, your immune system is gonna attack it in a fresh way, and that's gonna include some soreness, some fatigue. Some people get a low-grade fever. There's all these spooky stories about anaphylaxis and this and that. I think that's just because there's such a large number of vaccines being given that you're going to get these rare events. And then only the rare events are going to make the news, right? The 1 in a million type events will make the news. So I think in general, most people can expect to have a little soreness, maybe sore for a day or so. I did ask, so I also work at Clear Lake Regional, and I asked our whole group of ER physicians and our nurse practitioners and physician assistants. I would say in general, most people, I don't know, most of them even continued working. Just kind of maybe a mild headache or a little bit of soreness. Most people, it was fine.
Awesome. He had a follow-up question to that as well, and that was, how do you feel about the take-home and do-it-yourself tests that are kind of starting to show up?
So I wouldn't really trust those at all because, okay, so we hate the swab, right? Has anyone gotten a swab out there? So I had to get several, so I won't even tell you. I've had many swabs, and they are quite terrible. But if you don't collect the specimen right, you actually can't quite trust the results. And so the downside for the take-home test is that there might be some variability in the collection of the sample. And then probably the biggest downside, I'm a little spoiled here at Elite Care, but our turnaround is so quick. Our PCR test, it runs on a bay that takes about 45 minutes. And depending on how long that queue is, but within 6 to 12 hours, we'll text you the results. But these home tests, you have to mail them somewhere, or there's certainly a longer turnaround. I don't even know, but I think it's around 2 to 3 days.
Awesome.
So I suppose I wouldn't recommend it just because of longer turnaround.
Understandable. Somebody actually had another question about the test and the different types.
Yeah.
There says that they're saying that most schools seem to not accept the rapid test. So when's a good time to use the rapid test versus the PCR?
Rapid test. This is a good question. And if you line 10 doctors up, I don't know if we would argue, but it would be a long conversation. My my take home is that the rapid test is just not as good. So you can't really kind of trust the results. And the PCR actually is trying to detect viral fragments, and then it uses the technology. So it's super sensitive. I'll say it almost like this: the rapid test can miss, like if you really have infection, it can miss it. And then the downside to the PCR, it's so sensitive that it might actually pick up just viral fragments, like dead virus bodies, and you're not contagious. So kind of weighing those risks and benefits. A lot of the higher risk situations, like I know the airline industry and then schools where it's very important not to send home, send back to school a kid who's really sick. They're requiring the more sensitive test. So I'll probably summarize it like that. PCR is more sensitive. So I actually had a had a situation with my son where we had to get tested every other day. It was kind of for a job he was working on. And I ended up having 10 tests throughout this whole time. It was really dreadful. And actually, one of those tests actually came out positive. So there was this one little 4-hour window where I was like treated as if I had COVID. And it was just because the odds of a false positive when you're doing multiple tests, one will end up positive anyway. So I did experience the wrath of the false positive test.
There were a couple other questions around the test. This seems to be a popular topic. One is somebody asked, do you guys process the tests on site? And the other is the PCR test that you use, let's see, also able to tell the patient if they have other illnesses as well?
Aha, this is so good. Yes, we do it on site. And that's one of the huge benefits of our testing process is we don't have to send it off. One thing that really helped Elite Care, serve our community so well is that we're basically set up with the same kind of lab licensing as a small hospital. So we were able to very nimbly deploy, some of the same equipment that might be used in a bigger hospital. And so, long story short is that, yes, we are able to process them right on site. So we get the swab, we walk a few feet to our lab, and then we have a, kind of an assembly line process where we put them through our machine. And the next question, I already forgot. Oh, that's right. The PCR that we use is really, it's a virus panel. It's this beautiful technology where it actually tests for COVID as well as 20 other kind of respiratory pathogens. So we can test for, well, for example, we were having this little stream where kids were, being sent home from school with low-grade fever, runny nose, and it wasn't COVID. It was a virus called rhinovirus, which 3 years ago we would have just said, "Oh, you have a cold," but now we're able to identify that it's actually rhinovirus. So I'm loving the test that we have because it's really changing kind of my whole view of respiratory viruses. It's a wonderful thing.
Awesome. Here's a question concerning masks. There's things floating around, and that's, are there any harmful long-term effects from wearing masks?
Wearing masks, oh brother. So if you want to hear about masks, then we should talk to my father-in-law. He's quite passionate that masks are the most terrible things. And I will say, kind of from my perspective, I'm perfectly neutral about them. I don't think there's any long-term effects from it. I personally, I wear a mask all day long at my shift. And then when I'm out and about, I wear it almost as a statement of solidarity. I don't feel that I would ever be able to, at this point, I'm not passing it because I'm vaccinated and I had the disease, but I wear it as just to be polite, really. I don't want anyone to be nervous around me. So long story short, no, there's all kind of things you might read, like rebreathing your carbon dioxide. I just really can't think of anything. I will say, if you have a mask or somebody wears a mask that's just like, one of those things that you bring up, maybe a man has a beard and brings it up, certainly you want to wash it. So there would just be basic hygienic things. I personally use a disposable mask for a couple of days and then throw it out.
What about as far as a parent and with a child and masks and all those things? What are some tips or things you have for the parents as far as handling this whole situation the right way with kids in their masks?
Yeah, right. So my 9-year-old, he's a passionate can I use the word anti-masker? He hates that thing. But yeah, so we put it on. We have a little bin in our washroom where, every couple of days we put the mask in there, we wash them separately, we hang them up. It's just really a workflow of keeping them clean. I will say kind of from a public health perspective, even though the mask, like the kids are like dropping it on the floor face down and all this thing, I will say there's been just a drastic decrease in other viruses and other illnesses. I will say I personally have not seen a single case of the flu. I hear almost like a unicorn or something, like every now and then we'll pop positive for a case of flu, but all of this mask wearing, there's pros and cons to it, but it certainly has decreased illness, the other illnesses. Just change them out. My kids, like, well, for my 9-year-old, I'll notice, like, I'll get his mask and I'll notice that it's kind of dirty on the inside. It's like, oh yeah, let's get you a fresh mask type of situation.
Should kids under 10 wear a mask in public, even though it's not required?
Aha. So I let my little guy take off his mask or kind of half-heartedly wear his mask. I do firmly believe that kids aren't as contagious. There's some data to support that. And but then what I'm trying to teach my son is that there's high anxiety, especially if you have medical risk factors, or if you're elderly, caring for an elderly. So I do feel strongly, and this is why I tell my 9-year-old that it's polite to wear a mask in this in this climate. Still, hopefully, at some point, I hope we can kind of chill out about the mask issue. But I do tell him to wear it, largely to be polite. Now, we did just take a flight yesterday, and I know that the FAA is now requiring masks for age 2 and up. So I did tell him, Jackson, it's a law now. You got to wear your mask, buddy. And that starts on the premises of the airport. I think that started February 2nd.
Excellent. Obviously, we know the tests are offered there at Elite Care in League City. But Richard had a question, because some people are just getting it because they want to travel or they need it for this or that. But what if somebody needs to come in because they are actually symptomatic? Do they need to call ahead and schedule an appointment, make you aware? What's the process for them?
So I would say that there's kind of a gray line between kind of very mildly symptomatic, where you can actually still participate in our in our testing line, and then more serious, like you're coughing or you have fever for several days, where you would certainly want to be evaluated in our ER, because you would need a chest x-ray at that point. You might need some antibiotics or steroid. If you're just coming for testing, then that's kind of all you get, is you get your test and we'll text you with results. We do have a healthcare provider, either a physician or nurse practitioner or physician assistant, that sees every one of our patients. So if there's a patient that's a little too sick to be just in the testing line, then they'll be asked to go be evaluated as well, just for safety. So long story short, if you're having very mild symptoms and you wouldn't need any treatment otherwise, just maybe a slight runny nose or the loss of taste, then you can get tested. You can get it documented for your employer or for school, and you can start home quarantine, all from our testing line. And then if you're feeling sicker, or if you want more diagnostics, or if you want to get some medications, then you would want to be seen in our main side. And we actually have a really smooth way to keep everybody safe, through all of this process.
With the families that have children that are involved in school and going to these other activities, especially here in the state of Texas, where things are a lot more open. If they live in a home with family members who are especially, more of a higher risk,
right?
What are things that we can do at home to make things a little bit safer for those who are high at risk with the kids that are coming in and out?
Right. I don't have a good answer for that, because I do come across families where they, there's an elderly parent living in the home, and I feel bad for them, because there really is a tremendous anxiety that's been now just weighing on these families for, up to a full year now at this point. So just common sense stuff. It does really work, to have maybe a hand sanitizing station before you come in, and then you can have, kind of separate, eating areas. Certainly distancing can occur while you're in your home. I don't really have a good answer for that. I do really like that a lot of the higher risk patients are now getting vaccinated. And I think that is a big important thing. My parents just, were vaccinated recently. And I think that's kind of easing that weight a little bit, just that heaviness, the isolation and the anxiety. So I suppose as soon as they're able to get vaccinated, I would recommend that.
And we've talked a lot about testing, that it's available here at Elite Care. But if somebody does come in and they're more than just symptomatic, they're really not doing well, and they do test with COVID. Richard's asking if someone needs to be monitored because of COVID. Do you have in-house observation available? Do they have to go to a bigger hospital? How does that work for them?
This is such a good question. So yes, we do actually at Elite Care have an observation unit where you can stay and safely receive oxygen. You can safely get any medications that you need. So yes, we're trying to do our small part to help the hospitals. I know a lot of the hospitals are very full. So we have at least 2 areas. Sometimes we can go up to 4 areas where you can stay up to 23 hours. We also have the monoclonal antibodies, from the state. There are certain patients that are kind of mild to moderate sick, not sick enough to be in the hospital, that can receive an infusion of monoclonal antibodies, and we do have that available as well. That usually is about a 4-hour infusion, and then you would go home.
Excellent. And these were great answers. I think everybody got a lot of awesome information. So we appreciate that. Leslie actually just came in with one last question here. Can you keep children for observation as well if they're sick with COVID?
Yeah, sure, we can. I really have not seen a child sick enough to be admitted with COVID. So I'm kind of skirting that question. The only pediatric patient since COVID started that I hospitalized was actually a 3-week-old baby. And that baby wasn't even sick, but I was just kind of like, that baby's so little, I'm going to just watch you overnight. And this is when I was working at the hospital. So great question. But maybe some reassurance. I have not seen a single, child sick enough to be hospitalized.
Well, I'm sure
except the baby.
Sure. No, that brings a lot of relief. I think everybody's, mostly stressed or feeling anxiety about their kids or about their loved ones who are high risk, and not so much about themselves. I think they're all concerned about others. So, Dr. Vincent, this has been incredible. So much information. Is there anything we didn't touch on, or anything you want to just kind of leave with us before we wrap it up for today?
So I'll just talk just real briefly about therapeutics. I feel like doctors we're always being bombarded with does this medication work? What about ivermectin? What about steroids? What about even hydroxychloroquine is coming back off and on. And I will say that my colleagues and I have one colleague in particular, it's almost his hobby to keep up with it. So me personally, I feel that there is some medications that will help. I'm a big believer in starting steroid. So that's something to be done if you're starting to feel a little more symptomatic. I have one colleague who's really big into ivermectin. I'm not quite as big into it. My point is that I feel that we have a little hub here at Elite Care of folks that are really keeping up with it, that we're kind of nimble enough to provide therapeutics that are a little trickier to get through bigger hospitals, perhaps. And I feel that you'll get really great care while you're here. It's a little harder to get through our phone tree because we have so many more calls. But if you have questions, there is a doctor or nurse that can actually answer real specific questions. Do I need to come in? This or that. And we're also happy to do that anytime.
Awesome. Also, we just want to remind everyone, if you do need to come get tested here at the ER, if you go to elite24er.com, and there's a lot more to that URL if you want the direct link. But if you go to elite24er.com, there's a banner at the top that you can click, and you can register online. They'll message you through your phone, let you know when they're ready for you to come in, and you can walk right in. You don't have to check in with the front desk. You can literally just come right in, follow the blue lines, get tested, and in a very, very safe environment. So, Dr. Vincent, we appreciate it.
Thank you so much. Thanks for all the nice things you're saying about us too.
Desert to the office. Desert to the office.
There you go.
we're hard at work here at Elite Care.
Yeah, that might be our.
All right, we'll stay
and head out, but we'll be doing this again soon, and hopefully frequently, so you can ask your questions next time we're here live with Dr. Vincent.